Hey YouTubers, so today is Medical Thursday, so yes, Medical Thursday right now, so obviously not Dr. Flash damn time, so anyway, I have another topic right now, no random topic for Medical Thursday. Today's topic is about chemotherapy and quitting tobacco. So you have tobacco, cigarettes, cigars, and pipes, and chewing tobacco and dipping tobacco, and snus and snuff and vaping, and then you have chemotherapy. Now what is chemotherapy? What the hell is chemotherapy? Chemotherapy is a drug, basically a pharmaceutical drug used to treat cancer, for example, all major types of cancer. So you have like bladder cancer, prostate cancer, lung cancer, rectal cancer, colorectal cancer, kidney cancer, lung cancer, all the major types of cancer. Chemotherapy can be used to treat cancer. It is considered a treatment, a freaking treatment for cancer. Now, there are some cancers like thyroid cancer and also like skin cancer, like a small basal cell carcinoma, where they wouldn't normally give you chemotherapy. So there are a few cancers where chemotherapy is not used, but that's the exception to the rule. Now, if you're a doctor, you're a freaking doctor, you're an oncologist, which is a medical term for a cancer doctor, a oncologist is a doctor who studies cancer, has told you, listen, you have a smoking-related cancer, and you're going to need chemotherapy. It's very, very damn important, very fucking important to immediately quit smoking or stop smoking as soon as possible ASAP, because while many people, there are many people who continue to smoke during their chemotherapy, and honestly, that's their decision. Nobody can force somebody to make a certain choice, because obviously people have a right to make their own choices in life, even bad ones. People have a right to make, shitty choices in life. However, I will say this, your odds of beating the cancer, because chances are, if you need high-dose chemotherapy, you have a pretty serious type of cancer, like lung cancer, for example, your chance of beating the cancer and going into remission increase dramatically if you stop using the product, whether it's chewing tobacco, dipping tobacco, cigarettes, especially cigarettes, fucking cigarettes, because cigarettes are absolutely horrible for you. They are the worst tobacco product out there. They're worse than cigars and pipes, big ass cigars, big ass pipes. They're worse than chewing tobacco. They are the worst of the worst. So they're just terrible. So if you have lung cancer, you have fairly advanced lung cancer, for example, I'm giving you a hypothetical example, and your doctor is telling you you need high-dose chemotherapy, it's always in your best interest to stop using cigarettes altogether. And there are programs that can help you. There's the patch, there's the gum, there's the inhaler, there's the lozenges, there's going cold turkey, there's many different types of smoking cessation options. There's certain medications that can help you quit smoking, because honestly, your chance of beating the cancer and also your chance of having less complications from the chemotherapy goes significantly up and down when you stop using tobacco products, when you stop smoking, especially fucking cigarettes, because they're just disgusting, So the whole freaking point is, essentially, if you're diagnosed really with any type of cancer, but especially a smoking-related cancer, yeah, it's one thing if you're diagnosed with like a little skin cancer in your nose, you may or may not choose to quit smoking, and that's really up to you. You have to make a choice as an adult, but in terms of like, if you have like, stage 3 lung cancer, and your doctor's telling you you need like 6 months to a year of chemotherapy, it's really time for you to quit smoking. I know it's hard, it's very hard to give up smoking, give up, fucking cigarettes in general, but dude, do you really want to die? It's like, especially if you're younger, you're, 40, 50 years old, it's like, do you really want to die? It's like, I know it's hard to quit smoking, just like it's hard to quit drinking, it's hard to stop using drugs, it's hard to do this, this crap, but honestly, it's in your best interest. And honestly, if you are a cancer, patient and you're recently diagnosed and you don't use tobacco, absolutely 110% don't start. Especially don't start using tobacco when you are sick. If you're sick with cancer and you want to start using tobacco, that is a horrible, horrible choice, because starting using tobacco products when you have cancer, when you're diagnosed with cancer, you're newly diagnosed with cancer, is a terrible, terrible decision. So the bottom line is, just be healthy in general. You're not a smoker, please don't start. It's not a good habit to start. It's a terrible habit to start. It's a horrible addiction to start. And if you do have cancer, smoking-related cancer, and you're being treated with chemotherapy, stop smoking ASAP. There are ways to help you, or if you have like mouth cancer, for example, and you are using chewing tobacco, there are ways to stop using chewing tobacco and dipping tobacco and snus and snuff, etc., etc. So anyway, have a nice day. Pretty fucking cool. Bye.